If bladder urgency is affecting your nights, this gentle exercise may help improve muscle awareness. There's no need to make this complicated. Give yourself one quiet minute and focus on slow breathing, gentle contractions, and complete relaxation. Point 1. A mirror isn't necessary and you don't need anyone else to watch you. This is a subtle exercise that can be practiced privately. Point 2. That's the basic technique. Gentle contraction, normal breathing. Brief hold and complete relaxation. Now let's build it into a simple 1-minute routine. Point 3. Start by finding a comfortable position, either sitting or lying down. Relax your shoulders, thighs, and buttocks and keep your breathing natural. Then gently contract the pelvic floor muscles, as if you were trying to prevent yourself from passing gas. Hold the contraction for about 3 seconds, without straining or holding your breath. Then release completely and allow the muscles to relax for several seconds. The movement should be controlled rather than forceful. If you feel your stomach, legs, or buttocks tightening strongly, reduce the effort and try again. The goal is to learn which muscles you are using and how to control them, not to squeeze as hard as possible. Point 4. As you continue, keep your breathing steady. You should be able to breathe normally while the pelvic floor muscles gently contract. Avoid pushing downward or tightening your entire body. A small controlled contraction is enough. Point 5. After every contraction, allow the muscles to fully relax. This part is important because the pelvic floor needs to contract and relax properly. Keeping the muscles constantly tight is not the goal. Point 6. You can repeat the gentle contractions several times during your 1-minute practice. Start with a comfortable number of repetitions, rather than forcing yourself to do more. Good technique is more important than completing a large number. Point 7. One important reminder: don't repeatedly practice these contractions while urinating. You can use stopping the urine stream once to help identify the muscles, but regular training should be done when you are not urinating. Point 8. If you notice your thighs, abdomen, or buttocks doing most of the work, pause and reduce the intensity. The pelvic floor contraction should be subtle and focused. With practice, it may become easier to recognize the correct muscles. Point 9. Try not to expect an immediate change in your nighttime bathroom trips. Pelvic floor training is a gradual process, and this exercise is only one possible part of managing urinary symptoms. Consistency and proper technique are more realistic goals than a quick overnight result. Point 10. Keep your evening habits in mind as well. Large amounts of fluid close to bedtime, caffeine and alcohol, can contribute to nighttime urination for some people. Point 11. If you regularly wake up several times to urinate, consider keeping a simple record of when you drink fluids, when you go to bed, and how often you wake up to use the bathroom. This can help you notice patterns. Point 12. Persistent. Nighttime urination should not automatically be blamed on aging. It can have many possible causes, including medications, bladder problems, sleep issues, prostate symptoms, diabetes, and other health conditions. Point 13. If your nighttime urination is frequent, new, or getting worse, speak with a healthcare professional, rather than relying on exercise alone. A doctor can help determine what may be contributing to the problem and whether pelvic floor training is appropriate for you. Seek medical attention promptly if you notice symptoms, such as blood in the urine, painful urination, or a significant change in your usual urinary pattern. Point 14. Remember that the purpose of this 1-minute exercise is to build awareness and control gradually. You are not trying to force your bladder to hold urine, and you are not trying to keep the pelvic floor contracted all day. Practice gently, breathe normally, and give the muscles time to relax between contractions. If the exercise causes pain or makes your symptoms worse, stop and seek professional guidance. Point 15. So if you want to try this routine, keep it simple, get comfortable. Relax your body, breathe normally. Gently contract the pelvic floor muscles, hold briefly, and then completely relax. 1 minute is enough to practice the technique without turning it into a strenuous workout. And if you continue waking up frequently at night, remember that finding the underlying cause is more important than simply doing an exercise. A healthcare professional can help you understand what is happening and choose the right approach for you. Point 16. You can make this 1-minute exercise part of a regular routine, If it feels comfortable, choose a consistent time when you can focus without distractions. There is no need to rush or increase the intensity quickly. Start with a few gentle contractions and focus on using the correct muscles. Over time, you can gradually build your practice. As your comfort and control improve, remember that consistency and proper technique are more important than trying to complete a large number of repetitions. The goal is to develop better awareness and control, not to make the exercise exhausting. Point 17. Pay attention to how your body responds over time. If the exercise causes pain, discomfort, unusual pressure, or worsening urinary symptoms, stop rather than trying to push through it. If you are unsure whether you are using the correct muscles, a pelvic health physiotherapist can help you learn the technique safely. You can also ask a healthcare professional whether pelvic floor training is appropriate for your particular symptoms, especially if you have ongoing bladder problems or difficulty controlling urine. Point 18. Most importantly, don't expect 1 minute of exercise to solve nighttime urination immediately. This routine is simply a way to practice awareness and control of the pelvic floor muscles. Nighttime urination can be influenced by many factors, including fluid intake, caffeine, alcohol, medications, bladder conditions, sleep problems, prostate symptoms, diabetes, and other health issues. If you continue waking frequently during the night, especially if the problem is new or getting worse, finding the underlying cause is an important next step. Point 19. Your nighttime habits are also worth reviewing. Try to notice whether large amounts of fluid close to bedtime, caffeinated drinks, or alcohol seem to increase your bathroom visits. However, don't severely restrict fluids just to avoid waking up. Your body still needs adequate hydration. If you take medication that may affect urination, don't change the timing or dose on your own. Instead, ask your healthcare professional whether your medication could be contributing to nighttime bathroom trips. Point 20, finally. Remember that frequent nighttime urination is a symptom, not a diagnosis if you regularly wake up several times. If the change is sudden, or if it is affecting your sleep and quality of life, talk with a healthcare professional. Seek medical evaluation if you notice pain or burning when urinating, blood in the urine, difficulty passing urine, or another significant change in your normal urinary pattern. The exercise can be a simple part of your routine, but understanding the reason behind your symptoms is just as important. Point 21. Another helpful step is to pay attention to your sleep itself. Sometimes you may wake up for another reason, and then decide to use the bathroom simply because you are already awake. Keeping a simple record of when you wake up, when you urinate, and how much you drink in the evening can help you and your healthcare professional understand the pattern. This can be especially useful when nighttime bathroom trips happen regularly.